The budget expires on, what, 15th of January. The thinking seems to be that your party in particular and Congress as a whole got such a black eye over the shutdown and the debt ceiling brinksmanship of 2013. They were not likely to see a shutdown again, certainly in an election year. But I would ask, or will we?
No, I don't think we will at all. And you know, and I was pretty upfront that I didn't think that was a very smart strategy, you know, going into it. Because the reality is when you do those kind of things, you hold the American public hostage in the sense, you know, they're the ones that suffer, and they've had absolutely nothing to do with this. We've got a very fragile economy right now. We need to be concentrating on that, and that simply doesn't help that at all. So I don't think at this point anybody wants, you know, another government shutdown. And so I think we'll get it worked out. The question is, what will the numbers look like? And we'll either come to an agreement or we won't, and then at that point, then you go forward with these continuing resolutions, you know, funding the government, you know, as you're funding it. And that's not a good thing either, in the sense that, you know, you need to be looking at these individual programs. Some programs work well. They need increased funding. Other programs in the course of the year or the past, you know, years are not working as well. They need to be decreased funding. Some of them need to be eliminated. And Republicans and Democrats agree with that. But if you just have the continuing resolution, there's really no mechanism to do that. And so that's just not a good way to run a budget. It's not a good, you know, this is a huge business. It's not any way at all to run, you know, to run an entity of well over $3 trillion.
Well, segue to Obamacare, the Affordable Care Act. 3 dozen, more than that, House votes to abolish. Are you resolved in your own mind, Senator, that it is the law of the land?
It is the law of the land. Again, I'm an optometrist.
And likely to stay in place.
Well, yes and no. You know, the problem is what we did was we took, you know, a situation that wasn't working very well. And instead of really reforming that, bending the cost curve, you know, with doing some things, we just added a bunch more people into the old system, essentially, you know, and they're going forward. But there's really nothing to control cost, and that was, affordability was the problem that we had that we needed to solve. We've done nothing to afford the, you know, to solve the affordability. If anything, costs have continued to, you know, to creep up as much or more than they have. So I think we're really going to have to start looking outside the box. I've been all over the state. I actually do look at my emails, look at my mail, and respond to those things. And I can't tell you the hundreds of people that are in situations where they've gotten a letter, felt like they had pretty good insurance, and now in going into the exchanges, you're finding that you know, that there's a very significant increase, and they simply can't afford it. What's going to happen next? The businesses have been, you know, postponed for a year, but those letters are going to start going out, you know, somewhere mid-year, maybe the first quarter, at the end of the first quarter, with potential, you know, rates there. And I think you're going to find the same sort of sticker shock. So I don't know what's going to happen with it. But it really is. It's not a good situation right now. I'd very much like to get rid of it and start over, in the sense that we have significant problems that we have to deal with. It's not right that you become uninsurable. It shouldn't be that you lose your job, you lose your insurance, you know, those kind of things. But I think we can do that without 20,000 pages of regulation, and that's not an exaggeration. It's over 7 feet tall, and $1 trillion of taxes.
Well, one of the criticisms has been that your party has offered no serious alternative. What's the bill number? When were the hearings held? Nothing like that.
But they really have, you know, and there's several bills out. I was a member, when I was in the House, a member of the Doctor Caucus, and there's many providers of health care now in Congress. And a lot of that stuff has been filed, and the way you do that is you increase competition. You know, that does lower cost. It doesn't matter what you do. Right now, we can watch the Geico commercial or some commercial for our car insurance or house insurance. You know, if there's a good deal in Maine, you can buy it across state lines. We need to have the ability to do that. you've got to make it such, too. I really like the health savings accounts, where you set aside money, where and have a more of a higher deductible, those kind of things. But the bottom line is it needs to be where people have some choice. Right now in the exchanges we have in Arkansas, in most of the state, there's only really two choices there, so it's just not a good situation.
What do you say to those senators who and they were told, it's a huge humiliation for the Obama administration, nobody questions that, but they would point out that some of those who were told maybe that you can keep your insurance if you like it and now can't, that their insurance basically was trash insurance and that they were paying for, that they were not about to get what they thought they were going to get had they filed, had they utilized.
Well, I think, again, if you visit with people that have actually in that situation, they felt like they had good insurance. I mean, we're talking about Blue Cross, Blue Shield. These weren't fly-by-night companies by any means. What they've done, though, is they've made it such that, and these are just numbers, but say you had 9 different options of the amount of coverage that you wanted. Just like with your car insurance, you can go down, you can have minimum coverage, or you can have all the bells and whistles. What they've done is eliminated 2/3 of those, and they've made it such that everybody's in that top, in the top brackets of coverage. And a lot of Americans just simply didn't feel like they needed that much coverage, okay? And that's made it where the cost has gone up dramatically. The other problem is that, when you dump many millions of people into the system, somebody's got to pay for that. And the people that had insurance to a large degree are the people that are paying for that.
Well, what can this system be, what, in your estimation, can this system be repaired? Now, they point to a portal, a website is not health care. It's the portal to health care or to coverage. Can this be fixed?
Well, the website can be fixed, certainly, and they will get that fixed, and it's better now, certainly than it was, although, still struggling. But, you've got to figure out where, right now we're in a situation where I go to the doctor, I'm paying, many hundreds of dollars a month, for health insurance. You go to the doctor, you almost feel like you need to go, to have some benefit from all the money you're spending. The doctor sees you. He knows that you're not paying the bill, that the insurance company's paying the bill. So the person and the provider really don't have any skin in the game. And you've got to do something to bend the cost curve down. The other problem that we've got is just, our health in general. You're doing a great job of taking your, responsibility. You're working out. You look great. I need to do a better job of that.
Oh my!
But and I do, try and walk and things like that. But the reality is, the way that our lives are dictated and structured now, sitting behind computers, not walking a lot, not getting a lot of exercise, there's just so many different components to this that we've got to get straight, and it really is a comprehensive thing. But I think Obamacare now, as it's structured, has a problem, because the only way that they're controlling cost is to cut pay to providers. And so right now we have a situation where many Medicare providers are not taking new Medicare patients because of the pay already. The same will be true of Medicaid. And so it's just not a very workable system as it is right now.
But you're not in